In name of the Almighty, the most merciful and the most beneficent. And this is the interpretation of the common X-ray tests for the postgraduates in Pakistan and the neighboring countries and the foreign examinations belonging to the UK zone or the American zone, which is part 6 questions. And somebody has actually connected with me to say that these X-rays are good, no doubt, but what your interpretation is different than in our imagination, or what we have actually previously taught was different. I said to them, because I have taken about 9 and 10 45-minute sessions and how to interpret the X-ray test. Please go through those recordings and try to understand how to interpret it, so you can easily interpret the X-ray. Secondly, remember it, one person who will go for the differential diagnosis is better than the one who's stuck on one diagnosis. That is my second advice to the candidates. Go for the differential diagnosis, and then according to if the scenario is provided, the most likely diagnosis, and then go for the other things like further investigations and your management plan, if the time allows you. This is the first one of today, that a 25-year-old who had a recent history of coryza suddenly developed high-grade fever with dry cough and very severe breathlessness. He admitted in the ICU when saturation dropped to 75%. Look this X-ray accordingly. Whatever is seen by everybody. This is the second one, a 14-year-old boy who had attacked by choking during dinner at the restaurant, received resuscitation in the restaurant and shifted to the emergency and accident department. He had given history of the mandibular oromaxillo surgery after head injury or after the head-on collision in the car accident. The third one, a 50-year-old who had wheezing for the last 2 years, given the past history of full ATT 3 years back. 3 years back. Now this is one. This is the fourth X-ray. A 35-year-old laborer had the history of refractory asthma since 7 years. His CBC showed eosinophilia of more than 21%. Look closely this X-ray. Another X-ray is showed here. A 50-year-old housewife She was presented with dry cough, breathlessness, and the coarse capitations. Mid and the lower zones of both fields. Capitation heard at the middle zone and the lower zones of both lungs. Fields with digital clubbing. And another X-ray showed a 50-year-old smoker, leather garment factory worker, presented with cough and shortness of the breath since 2 years. Since 2 years. Now these are the X-rays which are presented today by me in front of you. You have to interpret these X-rays. Take your time. If you want to see again, repeat these X-rays because it is recorded, and then interpret it confidently. I hope you can do it. See you afterwards.